My name is William Fagley, and today we'll be going over the Orthomyxoviridae virus, and this is Amanda Johnson and Courtney Harpin. And to start off, we'll just describe some general characteristics for Orthomyxoviridae and some species affected, diseases caused, and then a couple of large impact diseases on animals. The two diseases we'll go over is the H3N2 virus and the H3N8 virus. We'll describe some general characteristics, clinical signs, diagnostics, and treatments. And the general virus contains pathogens that can cause influenza in humans and animals. The influenza viruses attributed to the disease are spherical and generally around 80 to 120 nanometers in diameter. The family overall includes 6 genera, including the genre influenza virus A, B, and C, Zygota-virus, Coronga-virus, and Isovirus. Although the virus can transmit itself through an aerosol medium, the most predominant form of transmission is through the fecal-oral route. And surface projections of the virus include hemagglutinin, which is commonly labeled with the capital letter H, which facilitates virus attachment and envelope fusion with host cells, and neuraminidase, commonly labeled with the capital letter N, which allows the ability of the virus to enter and leave susceptible cells. And this just goes over some more of the species that are affected by the virus in general and the diseases caused. So the species affected are humans, birds, pigs, horses, and dogs. And then the diseases you can see on the right. These are the two diseases we will go over, H3N2, H3N8 diseases. And with these diagrams, you can view the neuraminidase and hemagglutinin projections off each of the different viruses.
So for the H3N2 virus, it usually affects pigs and dogs, and for these species, it shows up as upper respiratory disease, and this is caused by the type A influenza. And it's very contagious, and it is common in kennels and rescues, and it spreads quickly through those and pig herds. Any dog or pig that is a carrier, the virus can survive for up to 3 months. And for it being zoonotic, it's not commonly found in humans, and when it is, it's labeled as a variant virus because it is technically the H3N2, but it's just a different variation of it. And even though the virus can be found year-round, it is most commonly found in the fall and the winter season, and that's when the larger outbreaks occur. For the clinical signs, pets will show up and they will be depressed and lethargic, and because it's upper respiratory, they'll have difficulty breathing. They will also sometimes show up with discharge from the eyes and or the nose, and they will also have often on sneezing and coughing, but in pigs it'll sound like barking, and they'll also, due to discharge in the eyes, have inflammation in the eyes. And whenever they show up like that, just make sure that you keep them isolated in another room. For the diagnostics, a lot of times it can be diagnosed by clinical signs and with the addition of the pathological findings. Whenever they show up, this mimics kennel cough, except a lot of times they will be running a high fever, and you can also confirm the diagnosis with the PCR test by testing the nasal discharge. There is currently no effective treatment for this virus. There is some prevention and also some other treatment options. If it's severe, they can be hospitalized and given fluids. They can also be given antibiotics and expectorants to help with the coughing and to break everything up. And then just making sure that they are isolated from other animals. And for prevention, there is a canine influenza vaccine. And a lot of times you can request this, especially if you live in areas where there's been huge outbreaks like in Florida. But most of the time, some small clinics may not just carry it on hand, so you should request it before you go in.
Okay. There we go. Okay, excellent. So I will be talking about H3N8, kind of start off with general characteristics. It's a single-stranded RNA type A influenza virus enveloped with spherical or pleomorphic morphology. It causes canine influenza virus, or CIV. It first showed in racehorses in Florida. It was transferred to greyhounds and mutated to adapt to dogs. A specific version is now documented. N8 is not considered to be a zoonotic disease since it is host-specific. It's spread through direct contact with aerosolized respiratory secretions from infected dogs and also contaminated fomites, which would be a cage, people, etc. Its incubation period is 2 to 5 days, and it sheds the virus for 7 to 10 days after the first sign of symptoms. It's highly contagious disease from dog to dog. Morbidity rates are high, but mortality rates appear low. It's currently reported in this picture here in about 41 states. This is last updated October 2015. It's considered endemic in New York, South Florida, northern Colorado, and southern Wyoming. This was from Weeb 2015. High-risk areas would include your kennels, shelters, doggy daycares, grooming, and it's seen all year round. Okay, clinical signs. They can be asymptomatic, but it also varies from mild symptoms to severe disease. Mild disease can encompass a fever, moist or dry cough, thick, purulent green to bloody nasal discharge. About 80% of dogs have the mild disease, and about 10 to 20% suffer from the high fever and pneumonia, also from Weeb 2015. About half of the dogs who develop the pneumonia secondary to CIV without proper treatment will unfortunately end up dying. Okay, diagnostics for H3N8. It can be made through blood or nasal secretions. This includes PCR tests and ELISA titers. You can't rely on just symptoms alone since they can mimic other respiratory diseases like kennel cough. You can do a transtracheal wash and do a culture and sensitivity on that to determine what antibiotics should be used, and that's this diagram here. That's a transtracheal wash. Okay, treatments for this disease, basically a supportive therapy, and that includes fluid therapy, good husbandry, nutrition, antibiotics for any secondary bacterial infections. And if you do empirical treatment, you should use a broad spectrum antibiotics such as fluoroquinolones and beta-lactams. If the dog has a non-productive cough, then you should use a cough suppressant like hydrocodone. Well, it's the same thing. NSAIDs can be given for any inflammation or fever. Prevention and control is very important for this disease. So like we mentioned earlier, there is a vaccine available for H3N2 and H3N8. Can be separate or they can be a combination vaccine. Giving this a booster of this 2 to 4 weeks after the first vaccine, and then it is given yearly after that. You may recommend this to a show dog if they travel a lot, exposed to a lot of dogs who travel, so maybe boarding or grooming. For prevention, you can kill this with common disinfectants you would find at your veterinary clinic. Clean all your infected fomites like bowls and cages like mentioned earlier. Also isolate all sick animals and wear your PPE, so gowns, gloves, all of that stuff. And then just make sure your vet clinic has protocols in place that we talked about before. Don't let them be up front if they're coughing. Maybe go through a separate entrance.
Breaking news.
Oh my gosh, breaking news. So, AHA, the Animal Association, American Animal Hospital Association. I should know that, my clinic is AHA. So June 8th, 2018, they came out with an article about a study published in the journal MBio. Basically, some scientists have discovered that domestic dogs are harboring flu viruses that have the potential to morph to humans. So new flu viruses are being incubated in animals before they jump to the human. So examples of this would be in 1918, the Spanish flu believed to have went from birds to humans and killed about 10 million people. And then in 2009, the swine flu pandemic started in pigs and then went to humans. Research done by the Icahn School of Medicine in New York City found 16 influenza virus genomes from dogs in China from 2013 and 15 are similar to H1N1, which is responsible for the swine flu. The dogs that they studied were mainly from vet clinics with respiratory symptoms, and this led to identification of 5 new CIV genotypes, which were previously unknown in canines. So basically at this moment, dog-to-human transmission is unlikely, but it's important for us to monitor this disease as it evolves and changes.
So in conclusion, we went over the Orthomyxoviridae family overall. We then went on to go to the H3N2 virus to discuss its general characteristics, clinical signs, diagnostics, and treatment and preventative measures. And then finally, we went over the H3N8 virus to discuss its general characteristics, clinical signs, diagnostics, treatments, and preventative measures. And then we went over some breaking news about flu viruses.
Okay, well, I guess that's it. Here's our references. I'm Amanda Johnson.
And I'm Will Fackley.
And I'm Courtney Harbin.
And thanks for viewing our presentation.